सुर की गति मैं क्या जानूं, एक भजन करना जानूं। सुर की गति मैं क्या जानूं, एक भजन करना जानूं। अर्थ भजन का भी अति गहरा, अर्थ भजन का भी अति गहरा, उसको भी मैं क्या जानूं, उसको भी मैं क्या जानूं। प्रभु 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 करना जानूं, प्रभु 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 करना जानूं। नैना जल भरना जानूं, नैना जल भरना जानूं। सुर की गति मैं क्या जानूं, एक भजन करना जानूं। गुण गाए, गुण गाए प्रभु न्याय न छोड़े, गुण गाए प्रभु न्याय न छोड़े। फिर क्यों तुम गुण गाते हो, फिर क्यों तुम गुण गाते हो। मैं बोला मैं प्रेम दीवाना, मैं बोला मैं प्रेम दीवाना। इतनी बातें क्या जानूं, इतनी बातें क्या जानूं। प्रभु 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 करना जानूं, प्रभु 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 करना जानूं। नैना जल भरना जानूं, नैना जल भरना जानूं। सुर की गति मैं क्या जानूं, एक भजन करना जानूं, एक भजन करना जानूं, एक भजन करना जानूं।
Namaste, my dear brothers and sisters. The love and blessings of the Mother and Sri Aurobindo to all of you from Sri Aurobindo Ashram Delhi branch. This beautiful devotional song in the melodious voice of Mithu, which you are very familiar with by now, is a prayer, a simple prayer by a simple-minded devotee who says that I don't know much complexities. I just adore you and keep repeating your name. That's all I know. But then there comes something very interesting. Somebody asked the devotee that just because you keep singing the name of the Lord doesn't mean that he will forget to be just. And justice means also punishing you for your wrongdoings. So if he is merciless in administering justice, why do you sing his name? Because that's not going to save you from that impartial justice. The devotee says, well, I am just someone who is crazy in love. And when you're crazy in love, you don't think of all these things. I know just two things, and I enjoy them. And that is to keep chanting the name of the Lord, and I can moisten my eyes if the Lord does not respond. Beyond that, I know nothing. And that's what a simple minded devotee is like. And this type of simple devotion, when it is taken to its logical conclusions, the way Hanuman did, is an epitome of devotion. can take us to the divine, can make us meet the divine. Not only meet the divine, have a communion with the divine, it also gives us direct knowledge of the divine. And that's how knowledge can follow devotion. And then the devotee says, what's the use of all this devotion and knowledge if I don't do anything for the object of my love? So that's how action also enters. So the triune of the Gita, and knowledge, action, and devotion, are actually one. And one can start with any of these, and the other two would follow. What one starts with depends upon the inclination and temperament of the devotee. And one of the simplest but not the easiest. It's very difficult to be a devotee who is totally surrendered to the divine. To be a Hanuman is not easy, but it is simple. No other qualifications are needed, as this devotee says. I know nothing else. I do not know any philosophy and don't know have any knowledge. I just know chanting your name and to moisten my eyes if you do not respond. So that is simple devotion, and if it is uh, absolutely flawless and total, accompanied by total and complete surrender, then this devotee can see the divine, have a communion with the divine, be one with the divine, and get knowledge through the direct route. And when this devotee, who might have started without any knowledge, gets that knowledge, he may choose to express it in words. And when this devotee expresses that knowledge that the devotee has received in words, it becomes a scripture. So, simple minded devotee, when he gets this direct knowledge, did not have to read any scriptures. He may end up creating a scripture. That's how some of our greatest spiritual masters have approached the divine, be it Kabir or Surdas or Tulsidas or Guru Nanak or Sri Ramakrishna. They were all essentially to start with devotees. Now we turn to today's topic, which is bronchial asthma. Bronchial asthma is becoming more and more common, like the other lifestyle diseases, and I'm sure the environmental pollution is one of the things that is contributing to it. Apart from that, other factors in lifestyle are also important, and it's one of the major lifestyle diseases today. And not only adults, but children are also getting it. They used to get it, but seems now it's happening more often in childhood. And breathing is something, which we take for granted, because so long as we are breathing without even being conscious of it, without making any effort, it's an autonomic function. We don't have to think about it, which is very good, because if we have to keep thinking about breathing, then there will not be much time left for doing anything else. And suppose by chance we forget to breathe for a minute, then you can imagine what would happen. So we take breathing for granted, but it's only when a person is breathless and finds it difficult to take the next breath that the person realizes the value of breathing. It can be one of the most uncomfortable feelings, which sends the person into panic. And panic only makes that breathlessness of bronchial asthma worse. And therefore, what's important is to relax in that type of a situation. But then it's easy to say, imagine a young person staying all alone in a single seated room in a hostel, and or in a hotel while traveling, and then this person finds it difficult to take the next breath. But then again, one doesn't have to panic, and relaxation itself helps a lot, apart from the other things that we'll be talking about. Now, this type of panic which the person feels in the state of breathlessness is something which Sri Ramakrishna talked about when he was asked, or when he was talking about how intense the aspiration for the divine should be. The aspiration should be as intense as the hunger for breath that a person feels when he's submerged underwater. When the person is submerged underwater, the first thing the person wants is to breathe. The person wants air. And There's a great intensity in this desire for air, in this urge to breathe. That is the type of intensity the person should have for the divine on the spiritual path. So that's why Sri Aurobindo and the mother have also emphasized that apart from the aspiration being sincere and persistent, it should also be intense, because it can be sincere and persistent without the intensity. It also has to be intense. And that is sort of a good analogy which Ramakrishna has given. The type of intensity you feel for air for the next breath when a person is submerged underwater. And that is exactly the type of uh, urgency that the person feels during an acute attack of bronchial asthma. And these attacks have a way of coming more often at night than during the day. And therefore, the person may sometimes be alone. But then, in any situation in which there's panic, it doesn't help to be panicky. It's always a little more helpful to relax. And if we have to tell somebody, don't panic or relax, out of the two, telling the person relax is much more effective, because the more you tell the person don't panic, the more he panics. This is what the airlines have discovered. Sometimes when the plane is passing through a turbulence, which is rather bad, and the plane starts shaking, some passengers start getting panicky, but the pilot and the air hostesses, they have been through it several times, so they know that it will settle down. So they have two choices. The air hostess has two types of a choice: either to announce, don't panic, it will be all over soon. The other is relax. They found that if they tell people to relax, that works much better. If they don't panic, then people panic all the more. So anyway, with this little uh, digression and tete-a-tete, which may not have too much to do with the topic, let's turn to the PowerPoint. Now, this is a little recap. In the previous course, we talked about the respiratory system in detail, but once again, and this is the nose through which we get the air in, and then it enters through the windpipe, the trachea, which we can feel under the skin in the neck, and then it divides into two bronchi, each branch going to one of the lungs, and then after entering the lung, the bronchus divides into several branches which keep getting progressively thinner and smaller, like the branches of a tree, and that is what the bronchial tree is. So a little more intimate view of the trachea, the two bronchi, and then the bronchus on either side, dividing and subdividing repeatedly to form the bronchial tree, and finally ending in the form of air sacs, which have a very thin single layer of a lining, and through which the gas exchange eventually takes place. Bronchial asthma is essentially a disease of this bronchial tree, where there's a constriction, a narrowing of the passages, and that's why the person finds it difficult to breathe. And why that happens is because of exaggerated sensitivity of the airways, particulate matter, and some chemicals. The response of the airways to this type of material, any offending material, by constriction, by narrowing, is actually a sensible response. It's a part of the protective response of the body, so that undesirable material doesn't get in. If the airways become narrow, it will become more difficult for undesirable material to get into the airways. But then if it becomes excessive, if there's excessive sensitivity, then this becomes a handicap and leads to acute attacks of bronchial asthma, and then the disease can also become chronic because of this excessive sensitivity, which we call hypersensitivity or allergy. Because the person is allergic, the person has a normal response which is highly exaggerated. So being very sensitive, is never a very comfortable situation, be it the airways or be it otherwise normally in life. Being a little thick-skinned helps. So any extreme, even being extremely sensitive, can get us into trouble. So here the basic defect is exaggerated sensitivity of the airways to particulate matter and some chemicals, and this type of chemicals and particulate matter is getting more common in the atmosphere with our current sort of development. We call it development when we have more of chemicals and particulate matter, the result of the so-called development in society, industry, etc., etc. And in, the result is that we have more of this, and therefore anyone who has a tendency to be highly sensitive to this type of material can develop bronchial asthma. Now, the response of the airways to particulate matter and chemicals is bronchoconstriction, that is, narrowing of the bronchial tree becomes narrow, and excess mucus. It also forms excessive secretion, mucus, which is that sticky secretion inside the airways. And that also is a protective response because this mucus can then trap the particulate matter instead of letting it go further into the lungs. And then once it has been trapped, there are hair-like processes, the cilia in these lining cells of the airways. They keep sweeping this mucus, which has trapped the particles, up towards the trachea, and from the trachea it goes into the mouth, and then it gets swallowed. And if it is too much, it may get coughed out. So even if it is not coughed out, it is not much, it gets swallowed. And in the stomach and intestines, it can't do much harm. In the lung, it would have. So it's a sort of a protective response which becomes excessive, narrowing of the airways and excess mucus. And both, as we can see, would constrict the airways, narrow the airways. Airways would become narrower, smaller in their lumen. If there's bronchoconstriction, that is the muscle lining the bronchi that contracts, leading to the airway becoming narrow, and further, the airway getting narrowed because of this watery, sticky secretion inside the lumen. Now, if this happens repeatedly, bronchoconstriction and excess mucus, that can injure the airways. And the response to injury anywhere in the body is inflammation. And this inflammation is mediated by a variety of blood cells. And that's what happens here also. And these cells release chemicals, the best known and the most significant of these being histamine. And this chemical also produces bronchoconstriction and excess mucus. So further, insult added to injury, still more bronchoconstriction and excess mucus because of the inflammation. And this inflammation is because of the injury caused by the bronchoconstriction and excess mucus in the first place. So the result is that the airways are inflamed and damaged. So this is the cross section. If we cut it across a normal airway, then it is somewhat like this. But in bronchial asthma, we find that it is narrower, and it has these inflammatory cells, which are blood cells or their close cousins, which close cousins like mast cells. And they collect here in the wall, and this inflammation is because of damage. Here you can see there's a damaged part. This lining, the lining cells are not there here, indicating sort of in a diagrammatic way the damage done to the inside wall of the airway. So it's narrower, it is damaged, leading to this inflammation. The inflammatory cells are indicating that inflammation, and here is the mucus inside, causing a further narrowing and a blocking of the airway. So narrowing of the airways makes it difficult to breathe. And in technical terms, we say that the airway resistance is increased. And this is again a recap from YES.03. Say if this is the normal inspiration and expiration, we record it on a spirometer, then you find that if you ask the person to breathe in as much as possible, and then breathe out as much as possible and as fast as possible, you get a curve something like this in a healthy person. But if a person has an obstructive disease like bronchial asthma, then the person may be able to breathe in almost the same amount as a healthy person. It's not very different. But then when the person tries to breathe it out as fast as possible, the person just can't do it fast enough. And the result is that it takes a long time for it to come out. And mathematically, what we do is we measure what percentage of the total air that was breathed out within 1 second. Within 1 second of starting to breathe out, how much was breathed out? So this is the forced expiratory volume. That is expiratory volume, volume breathed out forcefully, FEV1. So the forced expiratory volume at 1 second. And as you can see, this fraction would be much smaller here. Say here, if it is about 50%, here it is hardly 20 or 30%. And if we see at 2 seconds, a healthy person has breathed out almost all the air that the person had breathed in, uh, starting with maximal inspiration. But this person who has airway resistance, higher airway resistance, has breathed out uh, hardly 50% at the end of 2 seconds. So this is indicator or an indicator of an obstructive lung disease. In contrast with this third curve, which is a restrictive lung disease, that the lungs can't expand enough, and therefore the amount breathed in is much less, but then it is breathed out at the normal speed because the airway resistance is normal. So it's breathed out, and because the person breathed in less, by 1 second, he has breathed out everything that he had breathed in. So this is timed vital capacity. That is, we are not only seeing the vital capacity, that is the capacity of the person to breathe, but we are also timing it, seeing it how fast this person can breathe out. And you can see that the difficulty is more during breathing out, because while breathing in, the rate is quite fast. It's while breathing out that it's difficult. And this is what happens also in a person during an asthmatic attack. The person finds that the difficulty while breathing out is much greater than while breathing in. And why that happens is because for breathing in, we create negative pressure in the chest and the air moves in. Negative means less than the atmospheric pressure. Air moves from higher pressure to lower pressure. So by expanding the chest, we reduce the pressure in the chest, and that's how the air moves in. During breathing out, we do the opposite. We create positive pressure in the chest, and as a result, air moves out from the chest, goes out into the atmosphere. Now, so while breathing out, we create positive pressure in the chest. Now, this positive pressure also squeezes on the airways. So, airways are already narrow. If they're further squeezed by the positive pressure during breathing out, they get still narrower. So, it's the squeezing of the airways which makes it difficult to breathe out. Happens. So, difficulty in breathing is more during breathing out than while breathing in, because the positive pressure in the chest while breathing out squeezes the already constricted and narrowed airways. Constricted because the muscles have contracted, muscles in the bronchial wall, narrowed because there's also mucus in addition, thereby adding to the resistance offered to the flow of air. Now, what are the symptoms of bronchial asthma? A person doesn't have asthma all the time. There are relapses and remissions. There's an alternation of symptomatic phases and essentially normal phases. The symptomatic phases could be of two types: acute, which is an emergency, and or chronic, which may last for weeks or months. That is, the person has difficulty in breathing, more while breathing out, generally at night, but it can be managed by the person himself or herself, maybe with an inhaler or something. So that is the chronic phase, and it can go on for weeks or months during certain seasons. It has a seasonal sort of a pattern. Whereas acute is an emergency, the person feels extremely breathless, and this has to be handled only by a doctor. That becomes an emergency. Now, our concern here will be primarily the chronic phase. Today we'll not talk about acute because that has to be handled medically. But then you have to see it to believe how amazing the reversal is. A person goes in a state of extreme breathlessness, uh, anxious and worried whether the next breath will come and how it will come. And that happens partly because the person, because of the panic, is trying to squeeze out the air harder. The more he forces the chest to breathe out air while breathing out, the more greater force he applies, the greater is the positive pressure created, and the more is the squeezing of the airways. So relaxing helps, but relaxing is not enough. If you give this person a slow intravenous injection of aminophylline, within a few seconds, when the person says, the person is so relieved and the doctor is relieved, so change is absolutely dramatic. So in an emergency, getting that medical attention and getting that intravenous injection is worthwhile if possible. But then may not be always possible because medical help may not be so easy to come by. Are there some other alternatives? That also we shall see, but nothing like the dramatic effect that you observe when you give a slow intravenous injection of aminophylline to such a person. So we'll concentrate on the chronic phase and see how it can be made less uncomfortable, how it can be made shorter, and how it can be made less frequent. That is, the remissions, the asymptomatic phases, how they can be made longer, and if at all it occurs, how the chronic phase can be made less uncomfortable and shorter. So let's see the symptoms during the symptomatic phase of chronic bronchial asthma. And breathlessness at rest, which increases with exertion. Doesn't mean that the person should not take exercise, but intense exercise can actually precipitate an attack. And in any case, intense exercise or any type of exercise may increase the breathlessness. And that happens because during exercise, the demand goes up, and therefore, airways which could meet the normal demand may not be able to meet it. So that's sort of, again, a usual sort of story everywhere in disease. Essentially, an imbalance between the supply and the demand creates the symptoms. And here again, while the person may be just a little breathless at rest, when you increase the demand, the person becomes more breathless. Then, when the air is forced out of narrow airways, it can produce a sound, a whistling sound, and that is what wheezing is. And it isn't easy being wheezy. Are there some other symptoms? Apart from breathlessness at rest, which increases with exertion, and wheezing, there may be cough. Eventually, the person can develop cough. If this type of attacks come frequently and often enough, the person may develop cough, which could be with sputum because of the excess mucus formed. This mucus can't be all swallowed in. Some of it gets coughed out, and this sputum is white and thick, which means white and thick because it's not infected, and thick because it is sticky. And the symptoms are at their worst at night and early morning. Now, triggers for a bronchial asthma may trigger an acute attack or might make the chronic phase worse. So it's the same triggers which can precipitate an acute attack, which becomes an emergency, or make the chronic phase worse. And we shall see how to make this chronic phase less uncomfortable, less frequent. The triggers may be uncontrollable or unavoidable, but are not unpredictable. The person gradually knows that these are the things that trigger an attack in me. So they are quite predictable. And that's how the person can manage the disease better if the person knows, which means that, again, patient education is important. The person to understand his disease is important because the triggers are generally predictable. Although the person may not be always able to control or avoid them. For example, if there's pollen in the air in a certain season, the person can't stop that from happening. But all the same, the person has a way of having some sort of a protection from that. And the person can arrange for it in advance, anticipate it, and because these triggers are predictable by and large. Now, which are these triggers? The triggers primarily are allergens, irritants, infections, exercise, occupational uh, problems, if a person is in a particular type of occupation, drugs, and mental stress. We'll have a look at these one by one. So, allergens, that is, things to which a person is allergic. And these include pollen grains, dust mites, that all this dust mites is a blanket term for all types of bugs which may be there in the household dust. Uh, and Normally, they don't create any problem, but a person who is hypersensitive, is allergic to these, can either have an acute attack or the chronic phase can become worse. Then fur, feathers, that's the animal coming from animals. And animal danders again refers to the flakes of animal skin and hair and so on, uh, and molds or fungi. Now, these are some of the common allergens. Irritants, cold air. So that's why one person has to be more careful during winters. Make sure that the air is warm and moist, and dust can be an irritant. Tobacco smoke, a major irritant. So a smoker can't blame anybody else for his troubles. The first thing he has to do is to stop smoking, because he is inhaling regularly one of the major irritants which can precipitate an acute attack and make the chronic phase worse. And to some extent, this happens also through passive smoking. And therefore, if there is somebody having asthma in the house, then it becomes all the more important that the smoker does not smoke. Industrial pollutants, all variety of chemicals thrown into the atmosphere by various types of industry, and vehicular pollutants, pollutants released into the air by the vehicles on the road. Then infections, respiratory infections, particularly viral infections. And these again also being more common in winters. Winters are a more difficult time for a person with bronchial asthma. Then exercise, intense exercise, particularly in cold and dry air. So intense exercise itself can be a trigger. And again combined with winter and dry air. A certain phase in winters during which the atmosphere is completely dry. We have gone through it recently in the north of India. Before we had a little rain and made it less cold as well as a little moist. Then occupational hazards. People working in certain occupations may be employed in an industry which invariably means either certain chemicals or dust. Say, dust could be even the dust flying from the wood for a person who's a carpenter. So various or the person whose job is to clean some place, clean places. So keep the place clean. So while dusting, dust will fly. So chemicals or dust, these can be occupational hazards for some people. Then drugs, beta blockers, which are given in heart disease, high blood pressure, and so on. And they can constrict the bronchi. And aspirin and other similar drugs can also do it. Similar drugs means those which are painkillers and bring down the body temperature in fever. Those other things like similar to aspirin or acting in a way similar to aspirin. Then emotional stress. Stress may trigger an attack. Panic may trigger an attack. In contrast, mental peace, relaxation, prevents the attacks, reduces the frequency of the attacks. But in practice, we find that the three majors or this tripod of triggers is most important in practice: cold, infections, and stress. And the three can occur together. In winters, respiratory infections are more common, and the person who is not under stress. On top of that, if the person starts getting more frequent attacks, the nights become more and more difficult, then the person is under greater stress because of the disease itself. And all this happens to a person uh, who is genetically predisposed to this type of uh, problem, or in terms of Ayurveda, whose Prakriti is a Vata Prakriti, Vata dominant Prakriti, and therefore more likely to get this type of problems. There's a correlation between the two. There are now plenty of studies available to show that the Prakriti shows a good correlation with the genetic makeup of a person. So, while I mean, those studies are very interesting and they have, in a way, substantiated the concept of Prakriti. If a person has to find out whether I'm more prone to it by getting the genetic makeup evaluated, that is much more difficult and much more expensive than determining the Prakriti. You can know your Prakriti through a simple questionnaire. You can't know, which is completely free. You know, many of those questionnaires are available on the internet. So you can know your Prakriti through that, but you can't find out your genetic makeup so easily. But the two are correlated. Now, treatment. The treatment depends upon understanding the disease. If you understand the disease, you do not fear it that much. The fear of the unknown goes. Then bronchodilators and anti-inflammatory drugs, because we have seen the two basic uh, problems or at the root are the constriction of the bronchi, so you dilate them, make them wider. Dilatation is widening. So drugs which widen the airways, and anti-inflammatory, the inflammation, so anti-inflammatory drugs. And both these can be given, both these types of drugs, bronchodilators and anti-inflammatory, by inhalation, by mouth, and by injection. By injection, generally only in the acute attack, and that has to be done by the medical person, a doctor or a nurse. But inhalation and by mouth, this is the choice that the patient has. And out of the two, the better route is inhalation. Using an inhaler is much better than taking pills. And of course, apart from this, the other important aspects of treatment are to avoid triggers, hyposensitization, which we shall see in a few minutes, breathing exercises, and yoga. Now, why is inhalation the best route for administering a drug? Why is an inhaler better than the pills? This is important to emphasize because many people have a fear of inhalers. They're quite happy with the pills, but when they use an inhaler, they feel as if they are treating a life-threatening situation. The situation does not become any more serious just because one uses the inhaler. Uh, so this is a sort of a misunderstanding, but it's a psychological fear which is understandable. That if I use an inhaler, it means that I'm really dealing with a life-threatening situation, and therefore people try to sometimes avoid an inhaler and prefer a pill. But actually, inhalers are better than pills because firstly, the effect is immediate because you're delivering the drug directly where the bronchoconstriction is. And because you are delivering the drug directly there, the dose required is much smaller than in a pill. A pill, gets into the body, it has to travel all over the body in the blood and reach, a small bit of it has to reach the place where it is really needed. Here you're delivering it where it is really needed. You're delivering it at the place where it is needed, and therefore the effect is immediate and the dose required is much smaller. And since the dose required is much smaller, the side effects are also minimal. Therefore, one doesn't have to be afraid of the inhaler. If one needs it, one can use it. One step at a time, inhaler in hand, I'll fulfill my dream and live life to the fullest. So, using an inhaler and having bronchial asthma does not mean that a person cannot live a full life. The person can still live life to the fullest in spite of using inhalers, in spite of bronchial asthma. Now, so you've seen understanding the disease, bronchodilators and anti-inflammatory drugs, which are best delivered by an inhaler. What else can we do by way of treatment? Avoid the triggers. Top of the list is cigarette smoke. The person smokes should stop smoking. If others around him smoke, uh, either the others have to be told and they have to listen to stop smoking. Good for the person who has asthma, good for the person who stops smoking. And of course, they have to avoid being in an atmosphere where people are smoking. Cold air. which means if the air is cold and dry, make it warm and moist, be in that type of atmosphere. And then fur, feathers, all these animal uh, things shed by the animals, these are major triggers, and therefore, this a person should avoid having a pet. Then intense exercise, which means one should be physically active, but not indulge in sudden, severe, intense exercise, particularly in cold weather. And pollen grains, they are there, but then uh, one can, in that particular season, avoid going out, keep the windows closed, use a filter. There are nasal filters available for keeping pollen out. Then to avoid dust mites, that is the bugs present in dust, one should wash the bedding with hot water regularly. Then ventilation, the house should be well ventilated. Allow sun in for at least an hour a day. Then avoid carpets in the house. The carpets trap dust and the animal products, and therefore carpets are no good for a person having bronchial asthma. So avoid triggers. The next thing in treatment is hyposensitization. The person is hypersensitive. Can the person be made less sensitive? And the principle is common sense. That is, get exposed to small amounts and keep increasing the amount bit by bit. The person may get accustomed to the allergen and become less sensitive. So we start with the injection of a very small dose of the allergen, that is the substance which causes allergy in this person. And after a few days, we inject again a slightly larger dose and so on. So this is hyposensitization. But it has limitations because the allergen is often not known. And there may be not one, but multiple allergens, and you can't hyposensitize against all of them. And that's why the efficacy of this approach is limited. Now, how about breathing exercises? The basic principle of all breathing exercises in bronchial asthma is slow, gentle, and steady breathing with the mind relaxed. So the person has to relax mentally and not try to force air out. Instead, breathe gently, and the flow of breath should be slow, smooth, and steady. Now, for that, various techniques and a combination of those techniques is helpful. So let's first break it out into two basic components: diaphragmatic breathing and nose breathing. Diaphragmatic breathing is abdominal breathing. Breathing in which, when we breathe in, the abdomen goes out. When we breathe out, the abdomen goes in. The way it happens in Shavasana. So that is the type of breathing that is more efficient. More efficient in the sense it can move more air with less effort. So diaphragmatic breathing, not chest breathing, but diaphragmatic breathing, abdominal breathing. And nose breathing, one should avoid breathing through the mouth because that has its own problems. And to some extent, bronchial asthma is related to mouth breathing. So if the person is a mouth breather, try and switch to nose breathing. Then pursed lip breathing as a concession to mouth breathing, because pursed lip breathing can sometimes make a person feel relaxed. So during an attack, the person can, for a short while, go in for pursed lip breathing. Then this Papworth method, which may reflect some of the yogic techniques, uses relaxation techniques, which we have plenty in yoga too, and slow and steady diaphragmatic nose breathing. So it combines all these things to some extent, and that's what's called the Papworth method of breathing. Now we turn to yoga itself. For the acute attack, if the person doesn't have the facility of going to a hospital and getting an injection, then can the person do something? And this is something this is a technique, chair breathing technique, which has been designed at Swami Vivekananda Yoga Anusandhan Sansthan at Bengaluru, SVyasa, the only place where I had some formal training in yoga. So the technique that they devised is the chair breathing technique. And how did they come upon it? The way they came upon it was through patients. They asked some patients who had come from rural areas what they do when they get the acute attack. And they said, क्या करें? चारपाई पकड़ के अम्मा अम्मा करते हैं. We just cling to the bed and remember the mother. Remember our mother, amma amma. So, they sit on the floor, hold the cot, hold the cot or the bed, and just keep doing amma amma. So, this gave them the idea. That makes the person feel relaxed. You always feel relaxed when you are supported by your mother or the mother. So, uh, you feel relaxed and breathe slowly and steadily while doing that. And that itself relieves the attack for those people. So from that, they made it an elaborate chair breathing technique in which the person sits holding the chair somewhat like this, the way that person would holding a bed. And it is an 8-step technique. We'll see what those 8 steps are. And this was then published in which and they studied the effect of this chair breathing technique during 110 episodes of acute attack in 86 patients, and they found in 70% cases the attacks were relieved through chair breathing in a mean time of 30 minutes. And the technique itself can take, depending upon how much time you spend at each step, anything from about 20 minutes to 1 hour. So it's a 8-step technique taking from 20 minutes to an hour. And by the time the person has gone through one cycle of this technique, we find that in 70% of the cases, the attack is relieved without using any drug. And this was published in 1991 by Dr. Nagaratna and Dr. Nagendra and Dr. Sita Lakshmi. Now let's see what those 8 steps are. First is mental relaxation, using a chair as arm support, as you saw in this picture here, holding a chair like this. And this type of a chair, an old-fashioned metallic chair, is actually the most suitable, perhaps. They use always that while doing it in Svyasa, but of course one can have variations. But the basic idea is to sit clinging to a chair somewhat like this. So relaxation, using a chair as arm support and going for instant relaxation technique, which is also a technique worked out by Svyasa, which a person can practice even sitting in an office, sitting on a chair also. And what is this instant relaxation technique? Tighten each part of the body one by one. This is quite the opposite of what we do in Shavasana. We relax each part of the body one by one. Here we tighten each part of the body one by one, starting with the toes, going right up to the face. And after making the whole body tight, so when we go to the next part, we don't loosen the part which was tightened earlier. So go on tightening each part one by one till the whole body is very tight, and then just let go, relax completely. Now this works because if one has to relax voluntarily, that is more difficult. But if the whole body is very tight, then letting go is much easier. It's something like, inflate a balloon as much as you can, and then if you puncture it, it just collapses. So that's the type of feeling one gets during this instant relaxation technique. So the first step in the chair breathing technique is also the instant relaxation technique practiced while holding a chair like this. The next step is relaxation of neck muscles and then chanting ah in low voice while bending forwards and breathing out. So synchronize this chant with breathing. Inhale and then chant while breathing out. This chanting will make the breathing slow, gentle, steady, and the person will feel relaxed because this has a significance, a sacred significance for the person. So it's the first syllable of Om, O, and Ma. So the person has that sort of in mind. Of course, one can use any other sacred symbol, whatever signifies the sacred to you, but one can just chant but then if one has a meaning associated with it, a sacred significance associated with the sound, it always helps more in relaxing. So chant in low voice while breathing out. Then neck movements in Vajrasana. Now the chair can be removed and can sit in Vajrasana and again chant synchronized with breathing out. Then Shashankasana. From Vajrasana, one can go to Shashankasana or the rabbit pose. Now chant Ma, the last syllable of Om, synchronized with breathing out. Then Tadasana. Then neck movements in Tadasana. Again, chant. So these neck movements were here in Vajrasana. Now the neck movements are, that is, looking back and looking forwards. So while looking forwards and down, one breathes out and chants Ma. Then Ardha Chakrasana, something a bit like the variation of Trikonasana that we have been doing. Ardha Chakrasana, again, while bending, breathe out and chant the last syllable of Om. Then Shavasana, and during Shavasana, again chant while breathing out. So these are the 8 steps: 1, 2, 3, 4, 5, 6, 7, 8. So this is an 8-step technique, and this is what was studied and found to be effective in about 3/4 of the attacks, in relieving them without using any injection. Of course, the effect of the injection is dramatic, but there are many places in the country where it's not very easy for the person to go for that, and that's why patients themselves have understood that if they relax and just sit down like this, holding the bed and saying Amma, Amma, that itself can relieve the attack. And it's taking a cue from there, from what the patients told, Vyasa worked out this 8-step technique. Now, apart from this, one can understand many ways in which yoga could help. Yoga looked at in a comprehensive way. Asanas and pranayamas improve respiratory function. Many studies have shown that. Then the reasons for which people smoke, they disappear. Mental stress and the need to sort of conform and so on. There are many, many factors which, for reasons for which people smoke, to lose weight. We saw all those things when we were talking about coronary artery disease, where we talked about smoking in some detail. Or maybe though we had a separate session also on smoking. We had a separate session altogether on smoking. Yes. And we kept mentioning smoking in hypertension and heart disease and so on. But we had a separate session on smoking in YES.04. So the reasons for smoking disappear. In yoga, if we look at it as a spiritual discipline, then improvement in immunocompetence. Yoga relaxes us, and when we are relaxed, immune system improves. And bronchial asthma is a disease of the immune system. It's the immune system which is hypersensitive. Hypersensitivity is also as much a problem of the immunity as immunoincompetence, which makes the person more prone to infections. So impaired immunity can be either reduced immunity or exaggerated immunity in certain situations, which is what we call hypersensitivity. And then stress relieved, the person's stress is relieved, and instead of just being able to manage stress, the person can fill life with love, peace, joy, and fulfillment. That is what essentially yoga is about. Just by the way, I mean, impaired immunity I was talking about, impaired immunity can express itself in 3 ways. One is becoming weak and incompetent, which increases the tendency for getting infections. The second is becoming uh, excessive, sort of like more aggressive in its action, which is what hypersensitivity is, or allergies are. Allergy and hypersensitivity, they are because of exaggerated sensitivity of the immune system. And the third is autoimmunity, that is acting against some part of the person's body itself. So these are the 3 ways in which impaired immunity can express itself. And all 3 are becoming more common because of various lifestyle factors, particularly inadequate sleep and mental stress. These are emerging as 2 of the major reasons for impaired immunity. and it can express itself in any one of the three ways, giving rise to different types of diseases, some related to immunoincompetence, some to hypersensitivity, and some to autoimmunity. So this is how a comprehensive view of yoga can help in the treatment of bronchial asthma. And on that also, we did a study at the All India Institute of Medical Sciences. Ram Prabhu Vempati was my PhD student, and his thesis was based on this study. It was a comprehensive lifestyle modification program based on yoga. So it was not just physical practices. The students, or sorry, the participants also got an opportunity to uh, listen to talks, to uh, listen to devotional music, have sessions on meditation, receive counseling for psychological issues. So it was a comprehensive lifestyle modification program based on yoga. And the program was a 2 week program, which was to be followed by another 6 weeks at their home. It was a randomized controlled trial, which means that we had 58 or so patients divided into two groups of about I think 57 patients, two groups, 128 patients, another 29 patients. These were, one was the experimental group, which received yoga intervention, and one was the control group, which did not receive yoga intervention, but we call that group wait listed intervention group, which means that they had the assurance that after the study is over, we will give them the yogic intervention also. So they had that assurance. So it's only during the 8 weeks of the study that they did not receive the intervention. After that, they were also given the same program, control group. So they were not denied that. It's just that they had to wait for 8 weeks. That was a wait-listed control. So these were the two groups that we had. And we found that in the experimental group, which received this uh, yogic intervention, which was a comprehensive lifestyle modification for 2 weeks, followed by 6 weeks of practice at home. And then everything was measured at the interval of every 2 weeks, 2 weeks, 4 weeks, 6 weeks, and 8 weeks. At 2 week intervals, everything was measured. It was found that in the experimental group, which is received the yogic intervention, there was a remarkable improvement in pulmonary function as compared to the control group. And there was less need for rescue medication. Rescue medication, is the use of the inhaler to relieve breathlessness. And there was a remarkable improvement, reduction in the need for rescue medication in the experimental group. And there was a significant improvement in the quality of life as measured through a questionnaire in the experimental group. This study was published in 2009. Now, coming to childhood asthma, the causes and symptoms are similar to those in adults. So basically, the disease is the same. It's just that it starts very early in life, but then there, because of starting early in life, it has special sort of problems associated with it. A child can be expected to get a sort of a different look at it psychologically in a different way. Parents also get more panicky when the child gets it. It affects the child's participation in sports. The child has to miss school quite often, and going for acute attacks, repeated hospital visits, all that can be quite traumatic for the child. Prevention and treatment is similar to that in adults, but the encouraging part is that about half of the children having asthma grow out of it in 3 years. And here's a published study which says so. Of course, the clinicians have generally observed that it improves. Childhood asthma improves with age. As the child grows up, it improves. And it may be because gradually the person is undergoing a natural hyposensitization. We saw that if you keep getting exposed to the same allergen repeatedly in small doses, one can get less sensitive. So that is happening in a child. And since the child's systems are still more adaptable, the child has greater plasticity. Over a period of years, the child's immune system gets more and more accustomed to the allergen. It becomes less and less sensitive. And that's how the children can improve and sometimes grow out of it completely. Well, all that should not really frighten anyone who has bronchial asthma. there are few restrictions on your life with asthma. As in case of diabetes, in case of bronchial asthma also, a person can live a full life just by taking good care of oneself. And this needs understanding the disease. And that's why knowing one's disease is important, understanding it is important. And there is now a World Asthma Day, which is observed on the first Tuesday of May. Let's hope and pray that we have more and more of the type of atmosphere where this day will no longer be necessary, because there'll be hardly anyone left with bronchial asthma. Some of this material you'll find in this book, Back to Health Through Yoga, in chapter 12. This is the meditation hall and the shrine at Sri Aurobindo Ashram, Delhi branch. And you're all welcome here. And those of you who join YES.05, for which a questionnaire has been sent, even if you do it in the hills, you will have to pass through Delhi and you'll get to see the ashram in Delhi also. Comments and questions are welcome directly or through email on yes@yesspirituality.com. The realistic anatomical pictures in the presentation were from Tortora and Grabowski's Principles of Anatomy and Physiology. Gratitude to the mother and Sri Aurobindo for making these sessions possible. And thank you all for being there. Any questions? Today we have time. I've been able to finish well on time.
There are no questions in the chat box yet, so if anybody would like to unmute and ask, they can please go ahead.
Seems everybody is finding it very easy to breathe. No questions. That's good. No questions means easy breathing. That's what we want.
Yes, Mukundji, please go ahead.
Thank you very much, sir, for a very comprehensive lecture indeed. When there is an acute phase, we have to rush to the doctor for the injection and things like that. But can some of these yogic techniques help?
Yes, that's what I said.
No,
that,
when you are in acute phase.
In the acute phase, the chair breathing technique.
Chair breathing technique, only chair breathing technique. Okay. Thank you, sir. Thank you.
There's a question in the chat box. Does massage of the chest help?
It might, especially by relaxing the person, because it's like the therapeutic touch. So a loving touch, a gentle massage might help, yes.
Also, you were talking about the general breathing exercise, but the regular pranayams which we are prescribed in the yogic practices, is there any particular pranayam which is beneficial on a regular basis, not just when we are having an attack, but any pranayam from the regular practices which you would like to recommend?
Not especially any particular pranayam, but I think full yogic breathing is one of the safest and most effective in all situations. And apart from that, some of the other breathing techniques uh, during the sort of phase when the person does not have have any attack, when the person is in a remission, that is going through the symptomless phase. Then other breathing techniques like dog breathing, cat breathing, uh, rabbit breathing, so those could find a greater place in the practice of that person. The person can practice those also, include those in the daily practices.
All right, if we don't have any more questions and if you don't have anything else to say, maybe we can close today's session.
Sure.
All right.
Thank you.
All right, we close with a moment of silence. Thank you, everyone.